But I think, for me, one of the things that has constantly been highlighted throughout all of the sessions is what I call the new and fast advancements that are being made in this space, whether it's related to drugs, whether it's related to clinical trials, whether it's related to new materials that are being made available for patients to better understand their illness. All of these things are burgeoning, and there is a world of resources and a world of opportunity to manage the disease effectively. With that said, Barry, I'm going to hand it over to you for your closing remarks. And of course, I would ask you to also to what's been the highlight of your day today and everything that you've heard.
Thanks, Anne-Marie, and thanks to our amazing panelists today. I have to say, really, we prepare for these things, and we look at them before, and we think about it, and we speak to everybody. But there's nothing like seeing it when it's all together and truly understanding the impact, both on the patient and, of course, of their family as well. And what we sometimes forget about is the impact on the team, on the care team themselves. And we do know that our care teams have gone through difficult challenges throughout the last couple of years, and many of them, have had to deal with stress themselves. So it's kind of an interesting situation to be a patient faced with the stress and dealing with a care team that that's also going through some of the same things that we're going through, but for different reasons. But today we didn't sense that from our care team, and what we really got from it today, I think, was a fantastic picture of the individualization of treatment right from the get-go, and some fantastic information about asking the right questions at the very beginning. Don't be afraid to ask the type of questions that you may not even think are important or relevant, but ask them anyways. As Dr. Bada said, he wants at least 3 questions from his patients. But also the multidisciplinary approach that's really taking hold for the stage 3 and stage 4 types of patients, those who can't be cured from surgery immediately, who might ultimately find a cure, after treatment and having surgery as well. So really interesting discussion in terms of the molecular profiling of the patients to find the right patient that would have the right treatment at the right time. And really a great understanding by in that discussion about the different types of profiling that's done, whether it's solid tumor or liquid biopsies that are coming into play right now, and matching those profiles with the different treatments as well. It was a fantastic lead into the discussion on clinical trials, because knowing those types of profiles that you might have give you those opportunities, as Dr. Bresden Masley said, to help answer those research questions that are out there. And the goal of the clinical trials really being to improve outcomes and quality of life. So we don't really know. They are research questions. When you get into a clinical trial, very often we hear about them too late in the process, when often patients' health is not or maybe disqualifying them from getting into the clinical trial. Hence the importance of understanding about clinical trials from the very onset of treatment, and knowing what those potential options are. And a fantastic explanation of the different phases of the clinical trials, understanding who might participate in, and even how we can link in patients in the more rural communities through virtual networks and so forth. Hopefully, eventually, into more decentralized trials, so that you can actually participate in these types of trials where you live. But as you can see, we're starting to focus a lot, and our PAC group, our patient-centered approach to clinical trials that we do every year, a clinical trials conference. We are really focusing now on how to bring people together who are actual clinical trial navigators to find those trials so that people can access them more readily. Really interesting to hear about the NIH trials where Canadian patients can participate out of country, but so important to hear from the Windsor Group and QCRO Group, Onco Quebec, and so forth on participating trials locally where you live in Quebec, Ontario, and the rest of Canada. And there are many sites that I saw that were put into the chat. I put in a few myself about where to access or find clinical trials. And almost in every province, there is a clinical trial site. And very often the hospitals themselves have clinical trial going on in their own centers that the oncologists can let you know about. But really interesting statistic about how few people participate in clinical trials or are capable of doing it across the country. So there is a need for equitable access. And I did laugh with our laughter exercise a little bit. I have to say those breaks were well timed and really enjoyed them as well. Just going on a little bit further about the know your team. Working with your oncologist, surgeon, social worker, both from the emotional and practical aspects, and this unique role of what we have in Quebec, the infirmière pivot or pivot nurse, who can help guide your pathway throughout the treatment. And there are some similar types of support mechanisms in different centers. Some often it's a social worker who may take the place of the infirmière pivot, but I think that's really important to look as a patient to look for someone who can help you and guide you through your process, both in and out of the health network and hospital systems. And as somebody pointed out, this is an iterative process where you can question back and forth between the patient and patient's family and the healthcare team. And finally, our last session just blew me away. Really fantastic input from our patients and Hannah, and of course, Colleen Cuthbert, Dr. Cuthbert, who we participated in a lot of research studies, even in early stage research studies, which we've had published. So really a good insight into the emotional and the physical impact on cancer that we can have on you. But always, as you can see from our patients, is that spirit of fighting and giving some meaning and personal ownership to your survival and to your treatment and to dealing with the side effects and consequences of the disease, including how to explain this to your own children. And a lot of these areas are focuses of research that we participate in at Colorectal Cancer Canada. Some of you may have seen some of the early basic research that we're working with Cancer Research UK as patient advisors into the microbiome in colorectal cancer. We're looking into accessing data and research with with Dr. Brenner at the University of Calgary as well, to have live data in order that our healthcare systems can react faster. We're looking at different research in terms of rectal cancer treatment and the watch and wait aspects and carrying on with treatment or accelerating or decelerating treatment. So Colorectal Cancer Canada, we do have a strong eye and input into a lot of research in patients' values and preferences as well in drug reimbursement, ensuring that we can get to you the most advanced and most effective treatments equitably across the country, and ensure that your input is heard by those agencies that make these types of decisions. So I want to thank everybody today for their participation, and those of you who have been watching this today. I know it's a long day and it takes a lot of time, and I hope that you benefit from some of the information that you heard today. And we look forward to seeing you tomorrow for lots more great information.